Greetings, I'm Professor Shimon Ray from the NEDPRA Global Centre for Nutrition and Health, and I'm the Executive Director of the Centre.
Hello, my name is Jørgen Torgersen Johnsen. I'm a NEDPRO Technical Officer, and my background is in public health nutrition.
And today, together, we will be bringing you insights into sustainable consumption as we head towards achievement of health and the 2030 Agenda by explaining the double burden of malnutrition across the life course, as well as some of the actions that we can all take. So really, to start off with, how is nutrition defined today? So the complex definition talks about the sum total of processes involved in intake and utilization of food substances for growth, repair, and maintenance. And of course, nutrients are stored in various forms and drawn upon when food intake is not sufficient. This is important in our understanding of malnutrition. Nutrition science aids this understanding as it helps us to study the nutrients in food, how the body uses these nutrients, and also how diet, health, and disease are interrelated. At the high level, nutrition, biological, and social sciences are interrelated, as you can see in this diagram. There are constitutional relationships with particularly molecular biology of food, with the biochemistry of food, and environmental relationships between the agricultural side of food and food security or insecurity. How are diet, malnutrition, and nutrition itself related? So a simple definition of nutrition is it's what you eat, which determines what you are, and of course, what you can do. And there's an overall fit to the individual, and that determines the capacity of an individual to do. Diet, on the other hand, is about the composition of foodstuffs and the way in which we consume meals, as we eat food, not nutrients. And malnutrition, on the other hand, is either inadequate intake, excessive intake, or an imbalance in intake. And it can lead to certain conditions, whether that's obesity or even very specific forms of malnutrition, such as those in medical care. But let's focus for a moment on nutrients. These are chemical compounds that are needed for growth and metabolism, and they have to be supplied in the diet as they cannot be synthesized in the body. The two main categories of nutrients are macronutrients, so protein, fat, and carbohydrates, which all give us sources of energy, but also have other important functions, and micronutrients, which are vitamins and minerals needed in tiny quantities, but absolutely essential for the maintenance of health. So some of the principles of a healthy diet are that we need to start early with breastfeeding, which fosters healthy growth and development and reduces later life metabolic risks, as well as risk of chronic disease. We need to choose a wide variety of nutrient-rich foods, so diet diversity is part of that. Amounts of nutritious food and drink that can meet energy needs but not exceed them, limiting those foods that are very energy dense. Preparing and storing food safely, so ensuring that nutrient quality, quantity, and food safety all go hand in hand. There are multiple factors that influence food choices, from biological determinants such as hunger, economic such as income, physical, so access, education, or even culinary skills, social determinants including culture and food culture in particular, psychological determinants including mood and stress, as well as attitudes, belief, and other social constructs. But when we think about the big picture, from food to health, food production, food environment, the dietary choices that determine nutritional status and health status, whilst there are many wider determinants, at every level, nutrition knowledge and application is important. So let's think for a moment about the global nutrition transition that has happened in that stepladder from food to health. So this is a complex diagram, but if you look closely, you'll see that it shows 5 sequential patterns which have taken place in an evolutionary manner. In pattern 1, we see Paleolithic man, pattern 2, first settlements, 3, industrialization, 4, the pattern of non-communicable disease, first arising due to oversupply, and pattern 5, which is where we wish to get to. Nowadays, we see an overlap of patterns 2 and 4, where we see the diseases of undersupply and oversupply coexist. And this is known simply as the double nutritional burden. The coexistence of both under and overnutrition and associated chronic diseases, and of course undernutrition, can often be accompanied by micronutrient deficiencies, and equally those with obesity may also be micronutrient deficient. But this double burden can occur not just in the same populations, but even in individuals through the life course at different stages. They may be experiencing different types of malnutrition. And this is a huge challenge to policy and resource allocation. Since 2020, due to the COVID pandemic, there has been an increased emphasis on the role of nutrition, and really a highlighting of the fact that after this crisis, nutrition needs to be understood and recognized as indispensable. But really, the problem of inequalities in the global burden of malnutrition continue. And this relates to both under and overnutrition, therefore accentuating the double burden. Here in this slide, you can see a number of different statistics relating to overweight and obesity on one hand and stunting on the other, which, as I said, coexist in the same populations. And in these populations, we need data and data-driven actions. We do have enough data to act. Please find out more from the Global Nutrition Report, which actually calls out to undertake a number of critical actions such as investment, building equitable, resilient and sustainable food and health systems which interact, focusing on collaboration between sectors. So food production, for example, is driven much more by economics and politics, whereas food choices may be driven more by modeling peer and peer behavior and through health advice. We need to leverage key moments to revitalize and expand nutrition commitments. And really, as the WHO reminds us, now is the time to really commit ourselves to eliminating inequalities. And we know from 2 subsequent SOFI reports, which look at the state of food insecurity in the world, that unhealthy diets are a leading cause of most non-communicable diseases. But unfortunately, healthy diets can often be seen to be costing more than unhealthy ones. And we need to look at the food system in order to remove the unaffordability of healthy diets, particularly in the wake of post-COVID changes. So I'll now hand over to my colleague Jorgen to take us through some of the actions to follow on from the double burden.
Thank you, Shimon. So what can be done? How should we rethink our approaches to tackle malnutrition in all its forms? While the double burden of malnutrition may pose a significant public health challenge for nutrition-related sectors and actors, it also presents an important opportunity for integrated action. Addressing the double burden of malnutrition offers an opportunity for alignment and coordination between those charged with addressing undernutrition, early nutrition, overweight and obesity, infectious diseases, NCDs, maternal and child illness, and diseases associated with aging. The double burden of malnutrition can be seen as a dual nutrition challenge or an opportunity for double returns. Programs and policies that aim to address the malnutrition burden through double-duty, evidence-based actions are likely to be both successful and cost-effective. Double-duty actions include interventions, programs, and policies that have the potential to simultaneously reduce the risk or burden of undernutrition. That includes wasting, stunting, micronutrient deficiencies, and overweight, obesity, or diet-related NCDs, including type 2 diabetes, cardiovascular disease, and some forms of cancer. Some examples may include policies to ensure access to optimal maternal and neonatal nutrition and care, the protection, promotion, and supporting of breastfeeding, including exclusive breastfeeding during the first 6 months, and appropriate complementary feeding in the first 2 years of life. Programs that foster healthy diets in preschools, schools, public institutions, and workplaces. Measures and policies that improve food security and ensure access to healthy foods by all individuals and families. And initiatives that ensure access to healthy and sustainable diets from appropriate and resilient food systems. However, actions to address different forms of malnutrition are typically managed by separate communities, policies, programs, governance structures, and funding streams. In a Lancet series from 2019, 10 double-duty actions were identified that have a strong potential to reduce the risk of both undernutrition, obesity, and diet-related NCDs. These actions have been proposed to effectively address malnutrition in all its forms in a more holistic way. It does so by summarizing evidence and common drivers of different forms of malnutrition, documenting examples of unintended harm caused by some undernutrition-focused programs on obesity and diet-related NCDs, and highlighting examples of double-duty actions to tackle the multiple forms of malnutrition. I will mention them briefly in this presentation, and it can be divided into health service, social safety nets, educational settings, and agricultural food system and food environment categories. Within health services, we have 5 actions. These include scaling up new WHO and antenatal care recommendations. For example, counseling about healthy eating and keeping physical active during pregnancy to stay healthy and prevent excessive weight gain. Scale up programs to protect and promote and support breastfeeding through, for example, eliminate the promotion of breast milk substitute like infant formula and follow formula. Redesign guidance for complementary feeding practices and related indicators by, for example, including new training curricula for primary healthcare workers to provide double-duty nutrition counseling. Redesigning existing growth monitoring programs, for example, for ongoing growth monitoring programs in contexts where childhood overweight is or is becoming a huge problem, including referral or appropriate counseling on healthy diet and snacks to address all types of malnutrition. And lastly, prevent undue harm from energy-dense and micronutrient fortified foods and ready-to-use supplements by, for example, promote healthy diets as the default measure to prevent undernutrition. For social safety nets, there's one action, and that is redesign cash and food transfer subsidies and vouchers by, for example, including strong education and behavior change communications focused on healthy diets, physical activity, and preventative use of health services. For educational settings, there is also one action point. So that's redesigning school feeding programs and devise new nutritional guidelines for food in and around educational institutions. By, for example, involve parents and children in planning meals and food in and around schools. Lastly, is the agricultural food system and food environments. Here we have 3 action points. Scale up nutrition-sensitive agricultural programs by promoting diversity in food production and consumption among poor households living in remote areas with little access to markets. And within design new agricultural and food system policies to support healthy diets by, for example, refocusing agriculture towards the production of nutritious foods such as fruits, vegetables, nuts, legumes, and whole grains, and making these foods more affordable for all. And the last action point is the implementation of policies to improve food environments from the perspective of malnutrition in all its forms. In addition to the actions in 1 to 9 that aim to improve food environments, implement policies such as, for example, monitor of and restriction nutrition health and health claims on food, snacks, and beverages high in sugars and fat and salt will be needed. So when we can think about double duty in practice using 3 levels. The first level is do no harm. Many important and effective programs are currently being implemented around the world to address the various forms of malnutrition. The first level of doing double duty is to assess and ensure that current initiatives, for example, policies, programs, and etc., are not increasing the risk of other forms of malnutrition or NCDs. For example, it is important to ensure that efforts and initiatives to feed young children affected by acute undernutrition also address the long-term risk of overweight and NCDs. Second level is retrofit. In this level, the focus of achieving double duty is to look at what actions are already being implemented and ask, do they or can they have potential or positively and simultaneously influence other forms of malnutrition? For example, some school food programs may target undernutrition, while others place more focus on restricting the intake of foods associated with unhealthy diets. Ensuring programs are tailored to reduce the risk of the double burden of malnutrition will reap double returns on the initiatives that are already functioning. The last level is the de novo action. And this third level is the most proactive one. This involves the development of new actions designed specifically to do double duty. This is based on assessing which of the actions above are potentially the most powerful candidates to implement in a particular setting. Reflecting on the local epidemiology, policy, cultural, environmental, and food contexts. This could include actions focusing on existing national priorities, as well as new actions for priority areas. The type of action and effectiveness will vary between and within countries. Design for double duty is not an approach of one size fits all, but a method of crafting nutrition actions that are appropriate to the individual setting. I would like to end saying that nutrition is the root of health and all we do, as this figure of nutrition in the Sustainable Development Goals clearly show. Thank you so much.
Thank you very much, Jorgen, and also thanks to all of the organizations working together with the Indira Gandhi National Open University, University of East Anglia, the MSSRF, Pradhan, ICRISAT, KISS, and Punjab University, in addition to the NEDPRA Global Center. Thank you. And as we conclude, here is a video by the World Health Organization, which summarizes the double burden and surrounding concepts.
We live in a world where undernutrition and obesity can exist side by side in the same country, home, or even person. Foods high in sugars, salt, and/or unhealthy fats are leading to unhealthy diets and are one reason why children may not be growing healthily, while causing other people to develop overweight or obesity. The consumption of unhealthy diets is heavily influenced by marketing. Easy access is fueling this new nutrition reality, but thankfully, change towards a healthier future is possible. By having a sustainable healthy diet made up of a variety of foods that are safe for consumption, we can promote health and have better abilities to fight illness. How do we do this? Good nutrition for women during pregnancy and for children in their first 1,000 days of life, including breastfeeding, sets them up for healthy adulthood and future generations. We should eat more fresh fruits and vegetables, whole grains, pulses, nuts and seeds, and less sugary drinks and foods high in sugars, salt and unhealthy fats. The less of these foods we buy, the more the food industry will be encouraged to produce foods that contribute to healthy diets. We can also call on our leaders to make the right decisions so that every person, everywhere, can afford and access good nutrition. When people like you and me, industries and governments work together to make positive changes, we can create a healthier world.